Hello everyone, I'm Dr. William Hausman. I'm the founder of Yellowline. Thank you for watching this short video. I will explain you how to register on our platform and to start sending cases to us. To register is very simple. You just have to send an email on one of these two addresses, admin@yellowline.com or Dr. Johanna Fileva at yellowline.com. For the moment, only dentists and orthodontists are allowed to register with us. You receive one email in response, so you have to check your mailbox, maybe also the spam folder. Then you have to click on the link to confirm your email and to choose a password. Congratulations, you are now logged in Yellowline platform automatically, and you on the first connection you will have to fill all the billing informations. All fields are required, but for some information you may not have, put something. It's not a problem. You can put 1, 2, 3 or whatever you want, but don't leave any field blank. You can click update for these billing informations, and then you will be automatically guided to the clinical preferences form. All the values there are predefined by default, and they are suitable for most of the treatments. But if you have special requests, special needs, you can adjust these values. Don't forget to click save, sorry. And then you are good to go. So the link to log in the platform is my.yellowline.com. Voila. Here we are on the login page of the platform Yellowline. This is my credentials. So I will sign as a client. And so you can see our platform here. So you are landed in the list of your patients. You see here in the red box that you have one action to undertake. For example, you have to validate this planning. We will see that in many others video. And you have 51 cases, for example. So we'll start creating a new case. So here, for example, mail. Example. You choose the treating doctor. In the first place, you will have to create the treating doctor. So you can click add new. And for example, one customer, one clinic may have multiple doctors registered on the same account. So I choose myself. Internal ID is to link your case with the software, with the practice software management. So if you use this kind of database in your practice to feed all the clinical information, financial information for your patients, you already have internal ID for each patient, and you can put this number here. It will be much more easy to search for this patient later. So let's start with the put here. Okay. So we create the case. Here we will spend more time to explain all of this product in a later video. But let's say that most of the time you will choose Yellowline aligners. You may want to choose Yellowline keys, which is exactly like Yellowline aligners, but it's for two-step treatments that begin during the mixed dentition stage. And the case is open for more than 3 years. If you want to produce by yourself the aligner, you can choose this, and we will provide you only the 3D planning with the STL files. You will start also. You can start also with the demo. Demo allows you to submit a case and to have very shortly a 3D viewer to show to your patients. The viewer is actually not exactly the definitive one. you may have more aligners on the final staging. It's just to show your patient that what kind of result he can expect, because the final result is our proposal. So if later you want to upgrade and to have aligners, you will be offered the possibility to directly upgrade from demo to aligners. Exactly the same with 3D planning or assessment only. Assessment only is when you want just one answer, yes or no, this treatment is possible. I will explain you this later. And also, you can, from the assessment, go to aligners, providing additional information, of course. So here we will say that we want, for example, a demo. We want to treat both arches, upper and lower, and we create the prescription. So here we put some information. For example, okay, so here you have to put some pictures. So for privacy reason, I will put like the 3D, but you will put real pictures. If there's some picture you don't have, you can put whatever you have. It's not a problem, but at least we need face front with smile. Of course, it's better to provide also the intro pictures. And at the minimum, we ask for the panoramic X-ray. Okay, so this is really the minimum that we should provide. Here is very important. You can, for the demo, you should provide only oral scan for the moment. If you want to provide us with physical impressions, you need to contact us directly. I will ask the developer of the platform to ask the option also to select physical impression for the demo. So let's consider that you use one oral scanner from this brand, for example, 3Shape. If you use 3Shape, you can directly register from the scanner at yellow line aligners, and we will accept the connection between your account and yellow line, and you will be able to send directly from the scanner the oral scan of your patient. We will be notified and we'll be able to get the oral scanner on the 3Shape communicate platform. If you want to provide directly the DSL file for the maxillary unavailable, it's possible also. So let's choose, for example, 3Shape and continue with that. Here you have a summary of your prescription. You click submit. And here you see that for a demo, you have to pay 120 euros. But for your first case, we send you a discount code, which is personal discount code, to be used only one time and for a period of time of 3 months. So if I click demo, you see now the fixed discount amount, and you have to pay 0. So you click submit. Here on the right, you see that you pay 0 for the demo. And if you want to upgrade and to get a full 3D planning, you will have to pay just the difference because the normal price is 250. So you just have to pay the difference it would be 130 euro. And depending of the product eligibility, for example, if your case is very easy, you have to pay in total this price. If it's moderate 25, it means that the first staging is maximum 25 aligners, and you will have 2 additional sequences of maximum 25 aligners. So in total, 75 aligners at the lower. And if it's more difficult, more complex case, you will have unlimited number of aligners for 3 different sequences. Here you have the limit of validity of the discount code. So we click submit. So it's like a payment of 0. So you confirm and pay. And this is all you have to do at the moment. So after that, our team will proceed with the setup, with the treatment plan, and you will receive a link, and you will be notified in the platform also that you have something to do. Exactly, for example, like the case we have here. So if we click on that case, we have to review everything was done. So the prescription was fully submitted. The case was assessed by the team of orthos. The 3D planning has been completed. And now we have to review this 3D planning. So it's my patient, so I have access directly to the software for the 3D planning, so I didn't put any link. It's a bad example, but if I want to accept the 3D planning, I just have to click accept, or I click reject, for example, and I ask for modification. So I will tell the reason why I want some modification here. Let's go back to the cases. Thank you for your attention. If you have any questions, feel free to send an email or call directly Dr. Fileva at the office. Thank you for watching this video. We will send you other links to other videos to explain more about the platform in a very short delay. Thank you very much for your attention.